Yeah, continue, doctor.
Okay, can I start now? Okay, so you can hear my speak, right? So far infrared is one of sunlight stored in the nature. So according to its wavelength, it can be divided into the near, middle, and the far. So the far infrared therapy. So the human body is easy to receive far infrared energy. So we can see the mechanism of far infrared. So the thermal effect achievement vasodilation, improve the peripheral circulation and reduce the pain. So far infrared therapy have a vascular dilation from the thermal, but also have a non-thermal therapy for the human body. So the non-thermal effect, like eNOS, that's on skin microcirculation. So this microcirculation can make wound healing. Also, this regulate vascular tone and permeability, also inhibit vascular inflammation by the oxidation stress, which is from HO1 and the TNF-alpha to reduce inflammation from the body. Also will increase angiogenesis. So this evidence further suggestion for FIR inhibits vessel endothelium growth, reduce vasosclerosis associated with oxidative stress, and improve vessel repair effect. However, most studies in Taiwan analyze its effect on vascular fistula rather than on the foot circulation of hemodialysis patient. Therefore, the purpose of my study to examine effect on FIR on foot circulation on diabetes hemodialysis patient. So hemodialysis patient undergone long-term hemodialysis treatment have a low limb weakness and impaired peripheral perfusion due to anemia, hypoproteinemia, atherosclerosis, vascular neuropathy, and aging. The rate of diabetes hemodialysis patient has increased year by year from 27.7% in 2000 to 50% in 2019. And my study unit was 59.6 in 2017. So my objective, diabetes patient, most of diabetes hemodialysis patient complain they have sore, pain, numbness, and weakness in their feet. Insufficient blood supply to tissue which cause abnormal neuropathy, numbness, and the tingle sensation of the feet. So they have 6 P signs: pain, cold, pale, paralysis, and paresthesia. Therefore, it determine whether FIR therapy improve foot circulation in diabetes diabetes patient undergoing hemodialysis. So in the method, we enrolled 80 eligible patient is 80. For the patient, we include criteria: receive hemodialysis for more than 4 years, having a diagnosis diabetes, patient able to respond oral and the physical exam. They are willing to receive FIR for at least 6 months and have a stable condition. Also, they were attending routine 3 times a week in the dialysis station. The exclusion criteria have patient unconscious or low limb amputation. They have in-step wound, so they were excluded. We obtain informed consent for all patients. Then we allocate the patient in the experimental group and control group. All patients, we find our patient total 19 patients will drop out from our study. Then we have only 31 patients in the experimental group and 27 in the control group. This is a quasi experimental study for the FIR, was applied on the dorsal feet dorsal both feet on the 25 centimeter above the skin surface. Each patient for 40 minutes, 3 times a week for 6 months. We study this study, we statistic analysis for pair t-test, independent t-test, and one-way ANCOVA. We also get IRB approved and trial registration in the Thai clinical trial registration. We can see the radiator. This is come from Taiwan. That is FIR-TY 101. So we apply on the dorsal of both feet on 25 minutes. This have a standard for the patient to the skin surface. Patient will lie down the bed, have in the supine position with leg together in the hemodialysis room. Room temperature set on 23 degrees Celsius for at least 30 minutes before we administer the measure. We conduct the post-test measurement immediately after the last FIR treatment. The measurement tool, we use the 6. 1 is subjective feeling. 2 is the subjective response. Subjective feeling, we use the Edinburgh Claudication Questionnaire. Objective response, we have 5. Use the 1 is temperature of the foot of dorsal. 2 is blood flow in the dorsal paris artery. And 3 is ankle brachial pressure index. 4 is the foot pressure sensitivity. And 5, foot sensitivity to vibration. the subjective feeling refer to the Edinburgh Claudication Questionnaire by Lane and Folk in 1962. When patient used we use the Edinburgh Claudication Questionnaire, so we admitted needs to determine the prevalence the symptom. First, we instruct the participant to walk continue for about 10 minutes. Then we ask them to rate the sore, pain, tingling, and the coldness in the feet. Then we will see 0 is indicated the absence of their sensation. 1 is indicated for normal feeling. So we can get this patient response. The temperature, we objective the response for the temperature for the doser. Patient will lie down on the bed and rest for 30 minutes. The DPA of the foot from a distance of 3 centimeters immediately before and after in radiating. Second, the blood flow in the DPA. This for pulse intensity indicates 0 to 3. 0 for no palpable, and 1 is a faint but detectable pulse. 2 for normal pulse. 3 for abounding pulse. We will take the patient dorsal pedis artery from the patient, have a 60 angle from the prop to measure the patient bounding. So we grade these things. Then we take the ABI. We measure the level of atherosclerosis using the ABI. So ABI is the ratio of the highest average ankle pressure to highest average arm pressure. Also, we have a 3 to indicate. So have a no blockage. If the data is 1 to 1.0 to 1.2. If they less than 0.9 for the peripheral artery disease. So we can see the patient, the ABI, the results. Also, we have to test the foot pressure sensitivity. We use the monofilament nylon wire inserted 10 grams of the force. When bound into the shape of the letter C against the skin for one side. Each foot have 11 sides, including the 3 on the back of the foot and 8 on the sole of foot. So we will indicate the patient when the patient feel the touch. Apply the phenomena to the various sites was randomized throughout the exam. The testing can be repeated at a site to ensure accuracy. So if patient response, no sensation is 0. The normal sensation and the identification, the correct size, we will give it a 2. But they will say filling the site, but incorrect the site. So we will give the 1, indicated the 1. So we will use for food pressure sensitivity. Also, we will take the food sensitivity to vibration. We use the 128 Hertz tuning forks to take the patient vibration. So we will place the vibration tuning forks on the patient large toe and ask them to report when they could no longer feel the vibration. So we will range the 0 to 8/8. Then we will modify the grading scale from the 0 to 2. So 0 indicates no sensation, 2 is no more sensation. The results, we will see the basic demographic and the clinical characteristic of hemodialysis patient with diabetes who completed this study. So this table, we will see all the data, no statistical difference. So it shows the patient experienced group and the control group, they are homogeneous in our study. For the assess the patient blood circulation throughout food baseline and after 6 months, the FIR intervention. So for the independent t-test, we will compare about their temperature, pulse intensity, and the blood flow, ABI, vibration sensitivity, and patient subjective measure. So we will see patient temperature, pulse intensity, and the blood flow have a statistic significance. Also, patient will subjective response. They feel the pain, sore, tingling, and the coldness have a statistic significance. So we will see the FIR therapy have improved the patient sensitivity and patient pulse intensity and the blood flow. Results on COVA for the subjective variable of the soreness, tingling, coldness, as well as the sensitivity to pain, tactility, and pressure in the right foot also show statistically significant improvement in the experimental vs control group. So ACOVA also revealed improved in the subjective variable in pain, atherosclerosis, sensitivity to vibration, and the sensitivity to pain, tactility, and pressure in the left foot. But this difference did not reach statistic significance. So discussion, thermal effect, objective measure of food temperature, DPA pulse strength, and the DPA blood strength after 6 months, and the treatment with FIR therapy in diabetes patient undergoing hemodialysis. So the same with study LINE and LIN study. Non-thermal effect promote proliferation of the vascular endothelium via stimulation of HO1 expressed leader to inhibit the TNF-alpha expression in hemodialysis patient has recently emerged as promising therapeutic target in the treatment of hemodialysis disease or circulation. So the same with other study. FIR therapy may have a great positive effect on the blood circulation than on the function. So, conclusion, objective measurement of the food temperature, circulation, and the neural function shows a significant improvement after FIR therapy. FIR therapy effectively improved the patient's subjective perception, their pain, sore, tingling, and coldness. So implication for practice, the symptom of physical discomfort corresponded with objective response, and that FIR therapy can improve both perceived sensation and actual function, food, blood circulation, provide nurse staff with professional knowledge about using FIR for their food health care to teach patients the correct food care. So thank you, you are listening. Here is my reference. Have any question?
If anyone had any questions, please drop your questions in the chat box. I request if anyone had any questions for Dr. Yuanmay Chang, please drop your